My name is Julia Lurz from the Heart Center of Leipzig, Department of Electrophysiology, and we will be talking about the mental AF trial today. We aim to investigate whether patients with atrial fibrillation undergoing catheter ablation would benefit from a 3-month app-based mental training with regards to reduction of symptom burden. Patients with atrial fibrillation have multifaceted symptomatology and they oftentimes suffer quite a bit, and also quality of life is reduced. Catheter ablation is often an effective treatment option, yet recurrences, especially during the 3-month following ablation, are common. So we try to find a tool to improve symptoms during this period. The Mindance app offers an audio-guided multi-modular program with different mental training techniques. And we conducted a program that we believe would be beneficial for atrial fibrillation patients. And we had a first part, which was the relaxation module, and it included breathing exercises, progressive muscle relaxation, and others to induce relaxation and to relieve physical and mental discomfort. And then the second part included mindfulness exercises that aim to refine the ability of introspection and interoception, which would relate to a differentiation of disease perception. Mental AF included patient with symptomatic paroxysmal or persistent atrial fibrillation who is scheduled for catheter ablation of AF, which is usually performed the day after. And Mental AF was a single-center investigator-initiated, unblinded, randomized trial that included patients with symptomatic paroxysmal and persistent atrial fibrillation over a period of 2 years. And the primary endpoint was the mean A6 sum score during the 3-month study period. And the secondary endpoints included patient-reported outcome measures. There were a total of 151 patients included in the final analysis. As for the primary endpoint, we found that the A6 sum score during the 3-month study period was 12.5 in the usual care group as compared to 8.9 in the mental training group. This difference was found to be statistically significant. And it related to a reduction of AF-related symptom burden of 29% for mental training. Then, as for the secondary outcomes, we found an improvement of the affect score. It is a measure of AF effect on quality of life for both groups. However, in the mental training group, the improvement was significantly more pronounced, and as for the global score, there was a difference of 8 points. This improvement was driven by an improvement in the daily activity domain of the score. Then there was the PROMIS Global Health. This is a more general assessment of quality of life, which improved in the mental training group only with regards to physical and mental health domain. Since patients with atrial fibrillation suffer from a relevant symptom burden and limited quality of life, even oftentimes after catheter ablation, we need adjunctive treatment strategies for these patients. So there are a few considerations regarding the beneficial effects of mental training, and there are a few different levels. One refers to a more psychological level, where we believe that mental training can alter disease perception, and also on a more physiological level, it should balance autonomic function, and of course it does lead to a stress reduction. And then there is the topic of patient engagement. So app-based tools can engage patients and take in responsibility for their own health. Additionally, app-based approaches bear huge potential as they are ubiquitously accessible and scalable. And ultimately, a more comprehensive approach to AF patients including common risk factor management, as well as enforcing physical activity and mental training would be important to improve patient care, especially as there's a huge overlap to other conditions such as heart failure with preserved ejection fraction. It would be interesting to know if app-based mental training would actually reduce AF recurrences. So this could be assessed by continuous monitoring, and also if it relates to other than the ablation cohort, which might have attenuated effects in this case. So a broader population would be interesting. And then this was a program that went 3 months, so we would like to see how this develops over longer term, especially as this would relate to patient adherence. It was okay to get them to train 3 months, and they train 50 minutes per day, but would they do that beyond the 3 months? So this is something that would need to be investigated, how that can be implemented. This concept could also be tested in other populations, in patients with other arrhythmias, such as ventricular tachycardia, or also in patients with heart failure with preserved ejection fraction. And favorably, we would have multi-center studies to have proof of the concept.